It's bonus round for this medical moment, and we're going to be talking about what's happening at this moment at PRECISIONeffect. Lauren, what is the inflection effect?
Inflection effect is our data-driven discipline of pinpointing and leveraging the most valuable data points so that we can make the best decisions to increase a brand's trajectory.
Can you boil that down for us?
Yeah, absolutely. So there's really 4 different areas of the inflection effect that we focus on. First, precision profiling, which is understanding who the target audience is to a very precise and specific level. The second is behavior mapping, so that we understand what behaviors we need to change and impact in order to make a difference in the market. The third is execution and figuring out how to pinpoint those right moments to interact with and provide content to our target audiences. And the fourth is really to focus on analytics and how we can continue to enhance and refine and make decisions, in many cases in real time, for how we can optimize the campaign moving forward. What sets PRECISIONeffect apart is 2 things. 1, the quality of the data that we have, and 2, the experts that we have to help sift through and tell our clients what data is most important and how to use it and how to make it actionable.
So if I can be able to figure out, what a particular physician looks like, what does that mean for me as a marketer?
So what that gives you the ability to do is to interact with that physician on a much more personalized level. So we're able to serve that physician with messages, with content that not only is going to be more beneficial to that physician, but also help them make better choices for their patients. So we're able to interact with them on a much more one-to-one level than before, where you were looking at big buckets of segments. That's no longer the type of communication that we're doing.
Are there other assets within this toolbox?
There are. There's a number of different assets that we're using, and the beauty of all of these assets is that they can be used all together as one package, or for some of our clients, they don't need everything. They've done a lot of legwork on their own, so we can come in and supplement the great work that they've done with other information like our behavior mapping platform. We can bring in our analytics team. So there's a number of different tools at our disposal that, again, can serve you from start to finish or to help supplement and really enhance the work that our clients have already been doing.
As a client, what can I expect from the inflection effect?
I think what you ultimately will get is a campaign that is incredibly effective and efficient, like it's never been before.
Connie, thank you so much for joining us on this episode of This Medical Moment. How do you describe the Navigator 365 to me very quickly?
Actionable market research for omni-channel optimization. Yeah. It's helping you define the optimal omni-channel engagement for HCPs, patients, and payers. And Navigator really helps you define the place of digital in the omnichannel mix. So for medical, marketing, sales, what channels work, do not work, have a high reach, high impact, low impact. All of those things are available in Navigator 365. So it gives people a lot of insights for planning, execution, and tracking. There's power tools available that let you slice and dice data. There is different views of the data. Basically, you can zoom in on what you need at that moment in time. You can compare and contrast specific data points. You can look at trends over time. So it's a Swiss Army knife. Not everybody needs everything at the same time, but it's all there.
Connie, can you explain to us what the multi-channel equivalence score is?
It helps you, let's say, relate the impact of a specific channel to that of the rep, or to that of the MSL, depending whether you're working in the commercial or medical space.
Connie, can you talk to me about the competitive set against the Navigator 365? Is anyone doing this in the market?
We offer the most comprehensive offering there. So it's, on the one hand, technology-wise, it's cloud-based and it's integrated with the planner and the tracker. Secondly, if you look at the number of channels we cover, it's the most comprehensive. It's 50 plus. It is the first and the ultimate omni-channel mix tool that's out there. So this sets us apart from anybody else.
At PRECISIONeffect, we love data, we love insights, we love anything that's actionable. And we can't really talk about that without having our own team, Dataholic, Pam Caputo, join us. So can you talk to us about this new offering that PRECISIONeffect is bringing into the marketplace?
It's media consumption data, but it's designed for us pharma marketers. It's designed with the end audience in mind of the HCPs. So it dives deeper into the things that traditional models don't really measure, like conferences, webinars, physician-focused apps. It's giving us all of that detail that we've been craving for years, but we haven't been able to really crack.
Well, that sounds really cool. So as a marketer, what am I using today? How is this going to be different?
I was most excited about the multi-channel equivalence score, and I thought this was brilliant because the gauge that we use in our pharma world is that rep visit. That's the holy grail. And what's happened in our world more and more, it's harder to reach those physicians. How do we supplement that? Where are the white spaces? How are we going to reach that physician in a way that's just as impactful or as close to being as impactful as possible as that rep visit? And that's what this information has, that there's nobody else out there that's putting it back to that MCQ score. So you can actually kind of go in and toggle and play with it a little bit, which really gets my data side excited to really, again, look at the different specialties, geographies, what are we looking at, how valuable is that data, and then we can kind of strategize where we need to put the dollars, frankly.
It was fascinating talking to my colleagues today to hear their excitement around the data that we're going to be able to bring to our clients as we move forward. Being able to leverage that data and all that information is going to change the way that we market to physicians and patients, and I'm excited to see what's next.